Thank you, Heidi. Okay, good afternoon, everyone, and thank you so much for joining the Coordinating Center's third installment of our Community Enrichment Series. Today, we will be focusing on finding a voice through self-advocacy. Next slide, please. I'd like to take a moment just to introduce myself since we will be spending the next 45 minutes or so together. My name is Megan Bazette, and I am a program director here at the Coordinating Center. I work within the Community First Programs or Supports Planning Division, and Community First Programs is the Coordinating Center's internal name, and it collectively describes the four home and community-based programs that we provide supports planning services for. This includes Community First Choice, Community Personal Assistance Services, Community Options Waiver, and Increased Community Services. The offerings vary slightly by program and each has its own eligibility requirements, but essentially they're designed to assist older adults and individuals with disabilities to live in the community. I joined the Coordinating Center in June of 2022, and just in that short time, I've seen so many wonderful examples of people advocating for themselves or for their loved ones. In fact, much of the information that has been compiled for today's presentation is based on the advocacy efforts that we have had the honor of witnessing firsthand here at the Coordinating Center. Let's go ahead and get started with just a few notes about today's format and requests that we have for those of you who have joined us. Next slide, please. Okay, today's presentation will be recorded. However, the question and answer session will not be recorded. We ask just that you please remain on mute. Please go ahead and use the chat to submit questions. And again, those questions will be addressed during the Q&A. We won't take questions live during the webinar. This is a safe space. There's no judgment. Participants agree not to share any personal information or opinions shared within the group outside of the group discussion. I would ask everyone to please silence your cell phones, and slides, documents, and any unanswered questions will all be emailed out following the close of today's presentation. Next slide, please. I'm just going to go through this quick disclaimer, and that's simply that this webinar is intended for informational purposes only. There's a wide range in both the format and scope of advocacy efforts, so in no way is the information provided today intended to be exhaustive. Next slide, please. Let's go ahead and take a look at our learning objectives for today. The key terms and roles is the first thing that we're going to cover. We're going to go through action steps, strategies for self-care, as well as accessing resources. Please note that our focus today is going to be on advocating for ourselves or for someone that we care about. We will define advocacy in other forms, but our deep dive today will be centered around steps that can be taken really by individuals engaging in self-advocacy or individuals who are advocating for someone close to them. Next slide, please. Okay, so why advocate? Many of us, myself included, really like to understand the why behind certain things. It provides a reason and a purpose to drive our actions, such as why do we have to complete homework? Because applying what we've learned and practicing through repetition helps us to retain that information. Why does a doctor cast a splint or a broken bone? Because immobility really prevents further damage and it promotes proper healing. Why is it important that we advocate for ourselves? Well, the voice of the person who is impacted directly by something is often the most powerful voice in the room. While testifying on a panel about transportation, I had the opportunity recently to hear firsthand from a consumer, a gentleman who utilizes the system daily. He described how concerned he was at one point that he would not make it in time to testify because his designated pickup time had already come and gone. It's these personal experiences that can just make such a difference. Quite often, advocacy is what sparks that need for change. Systems and processes are frequently put in place without the input of those who are directly impacted. Sometimes it takes someone saying, "Hello, excuse me, this part of your process is really making things difficult for me. I'd like to talk more about what I'm experiencing and see if we can work together to make a few changes." That one piece of communication we've taken and we've communicated our needs and preferences, we've raised awareness, and we've initiated a collaborative and problem-solving approach. These are the reasons why we advocate for ourselves and for those who we care about. Each time we're able to communicate our needs, we are likely to increase our self-confidence. Next slide, please. Okay. Now that we've touched on some of the reasons to advocate, let's go ahead and shift our focus to the different types of advocacies. There are numerous definitions, groupings, and ways to identify the range of advocacy efforts that exist. We're going to take a look at one model that breaks advocacy into 3 categories. As I mentioned earlier, our primary focus surrounds advocating for ourselves or for someone we care about, and that's what we're going to talk about today. Advocating for ourselves or self-advocacy is knowing what we need and want for ourselves and communicating that to others. Individual advocacy is what takes place when another person or persons communicate the same type of information on behalf of or for someone else. Individual advocacy, it's important to note too, can be formal or informal. If a family member or friend accompanies me to a doctor's appointment and communicates concerns that I have to the doctor for me, that's an example of informal advocacy. If I seek out a professional advocacy group, on the other hand, that will assist me in communicating my concerns, that's an example of individual advocacy that's more formal in nature. Again, the majority of our time today is going to be focused on that self and individual advocacy effort. And although we won't go into further discussion about systems advocacy during this webinar, it's good to have an understanding of the term so that we can put each of these types into context. Systems advocacy really takes place on a larger scale. This could be at the local, state, or national level. It targets a change in policy, laws, or rules that impact our lives. And the awareness that we raise through our self and individual advocacy efforts may translate into action at the systems advocacy level, which is a really important thing to note. It's important to remember that our contributions to advocacy, no matter how big or small they may seem, are important and meaningful, and they have the potential to be a catalyst for change. Next slide, please. Okay. Many of us are surrounded by advocacy efforts each day. Some happen so often that we might not always recognize them for the meaningful interactions that they are. Consider the parent or guardian who communicates the need for their child to receive additional support in school, or the person who lets their doctor know they'd really appreciate additional information about a new diagnosis. The number of examples that exist are limitless. I'll share an example just of a recent experience that I went through. About 2 weeks ago, I was in a local emergency room with one of my family members, and we had to go through the emergency room for a pretty significant physical condition. It was very, very crowded. It was late at night on a weekend. There were no seats available. It was one of the most crowded experiences I've had in a hospital setting before. And this presentation had been on my mind quite a bit. So I was noticing as we were waiting, everything that was kind of going on around us. And the advocacy efforts that took place there, mostly small efforts with huge outcomes. We might not recognize all the time as those significant, meaningful interactions, but they are, and they're so impactful, in someone's everyday life. For example, the individual who I was with, when this person met with a physician for the first time, the person I was with is a little bit older. She's in her 80s, and the physician didn't speak directly to her. He spoke directly to me. And the nurse came in and was kind of observing the interaction and right away said, "You can speak to her as well. She understands everything that you're saying." And I was so impressed by that because it really brought the individual I was with back to kind of the forefront. We talk about person-centered care all the time. And this nurse advocated for her to make sure that, the focus was brought back to her. You saw individuals asking for a warm blanket for their loved one they were with, or, there was a security guard who was there who was concerned that there was not like clear access to get to and from the restroom there. So he went ahead and made changes and spoke to someone else there just to make sure that all of the patients were comfortable and could access the services that they need. So it really, really exists all around us all the time. Okay, next slide, please. So when we talk about advocacy, we want to consider a few concrete steps we can take, not just to prepare ourselves, but also to take care of ourselves. So we're going to start with education. And education, certainly is the first and one of the very, very important steps in beginning to make advocacy efforts. It's so important to become an expert on the topic that you're talking about. There are all different, places and formats that you can receive additional information. You want to communicate and reach out to other individuals about the experience that they've had. It might be that someone else has had a similar experience, might be that someone else has had an experience where just a part or two were a little different. And if you know why those couple pieces were a little bit different, it can kind of drive even further knowledge in yourself. You want to familiarize yourself also with related efforts that have taken place. It's good to know what's already been done. Depending on the topic that you're talking about, you may really be interested to know if, for example, something's already gone to the systems level. That might have a little bit of it might give you a different starting point for your own efforts that you're going to do. But education is absolutely key, and we want to make sure that we keep ourselves informed all the time. It doesn't just mean that we're going to look up and do some research initially when the topic first comes up. Some of these topics are so fluid and there are so many changes that kind of come to pass within a small period of time that we want to make sure that we keep up to date and knowledgeable about all things that are happening currently. As far as where to seek that education and information, it depends on the topic. Your treatment providers, physicians, treatment team members, case managers, all these folks have access to a wealth of information and a wealth of written knowledge. The local library, the internet, reputable sites on the internet, I would say. The possibilities are almost endless these days on where we can find the materials to educate ourselves really, really well on a given topic. If you are not someone who easily has internet or computer access, the local public libraries generally are quite fantastic with being willing to help someone with accessing information on the internet, sometimes even printing it out depending on the library. So education is key because you want to go into any topic that you would be talking about as informed as possible. So your goal is really that you want to become the expert there. Okay, next slide, please. Okay, so our step number 2 is going to be organization. And this might not be something that everyone thought of, right away and what concrete steps we could take to prepare ourselves for advocacy efforts. But organization is key. And, essentially we want to be able to keep records of everything that we do, everything that impacts our situation so that we can always go back and reference as needed. That would include phone calls, doctor's visits, insurance bills, notices, forms about your cares. You want to remember that you can always request copies of your medical records or any other records. Different organizations have different ways to go about requesting records, and often they have a policy and procedure in place so that individuals can kind of be guided in how to do that. But historically, when I would go to a medical appointment, for example, I would ask on my way out, could I please get a copy of this x-ray or this test that had been done? Nowadays, too, of course, there are many organizations and medical facilities, especially, that have patient portals, and you have the ability to access your information and your records online. But again, for those individuals who don't have computer access, or perhaps you're trying to read records on your phone, or maybe you don't have the ability to be able to print something from your house, absolutely you can ask at your provider's office if they can please, keep you informed on the process for requesting your own records. And it's important too, you want to be able to keep everything in one place as well. You can use something as simple as a shoebox to put all of your documents in. I'm someone who has a tendency to want to put everything in one place and then go back and organize later. I have someone else in my family who likes to make sure that they get everything hole punched in a three-ring binder immediately. So whatever your organization style is, there is a way to do it, and it doesn't have to involve spending a lot of money on different supplies or anything else like that. There's lots of great information on the internet about how to develop a medical binder and how to keep it. It's something that's practical. It allows you to get your hands on your records so that you can access and reference anything that you might need. I believe that we'll also have a link and a resource page that we're going to be sending out after the presentation that gives kind of a step-by-step in how to organize a medical binder. While we are still on this slide, Heidi is going to guide us through or is going to screen share with us so that we can take a closer look at a really fantastic website that has a taking charge of my healthcare toolkit. So Heidi, if you don't mind pulling that up, thank you so much. Okay, so this is from the Oregon Office on Disability and Health, and that QR code will take you directly to this. And let me make my screen just a little bit bigger so that I can see all of the writing. I was so impressed when I went through this because they had so many free printables, and sometimes nowadays that's something that's hard to find on the internet. Perfect. Thank you, Heidi. So Heidi, would you mind clicking on supplemental materials, please? In this supplemental materials section, you'll see that there are printables for so many different items in here. And if we could just click on the first one, the doctor visit planning tool, please. Thank you. This gives someone the opportunity to kind of get their thoughts out on paper before they go to a doctor's visit. Many of us need to really kind of pre-plan out communication in advance so that we get the messaging across in the way that we intend. Because sometimes it can cause anxiety. They can get nerves and things like that when we're right at an appointment and we know we have so much to say, and all of a sudden it all leaves our minds, and we can't remember a thing that we had wanted to ask. But if you're able to access some of these tools and able to take some notes during your appointment as well, absolutely you can reference these. Heidi, would you mind going just back one to the previous menu? Thank you. Okay, so there is a medical appointment checklist. That's the second from the bottom on the screen. Great. And this is just a really great kind of right before your appointment or a few days before your appointment, gives you an idea of some things to do so that you're prepared, so that you get there on time, so that you know exactly what you want to say. Again, prompts you to ask any questions ahead of time. And then it also gives some guidance for during the appointment as well as after the appointment. Um, for individuals who have a significant number of healthcare needs, it can get to be so much to be able to maintain and keep track of everything that is going on. So some of these organizational tools, even if you don't always think that you really need them, might come across a time where you absolutely do. I found that just as I have started to get a little bit older and have other things come up like vision and things like that, that I wasn't managing before, it becomes overwhelming quickly. And especially if you're someone who's going to be advocating for yourself or for someone else, it's going to be really important that you keep as organized as possible. So maintaining that, those organization skills, keeping these records and using whatever tools we can is going to be very important. Thank you so much for sharing that, Heidi. We can go back to the slide, please. Great. Okay. So just a few other notes about going to a doctor's appointment. Sometimes you might not be comfortable taking notes in the appointment. You may not be comfortable speaking to your provider, or sometimes you find, the thing that we just mentioned happens where you have all of these thoughts that you want to get out and they all just kind of disappear as soon as the doctor walks into the room. Sometimes it's a good idea to take someone who you trust, whether it's a friend or a family member with you. They can absolutely ask some questions on your behalf if you're comfortable with it, and you would just kind of want to prepare with them for the appointment. But organization is absolutely going to be key. Keep as much as you can, because if you're asked ever during your advocacy efforts, can you give me an example of, when this happened to you? Why would you like to change that? It's going to be really easy for you to go back and to reference that. Okay. Next slide, please. Developing partnerships as you prepare to advocate for yourself or for someone else is going to be key. And it is also something that as you go through the process, a lot of it's going to naturally happen. There are many partnerships that are created out of advocacy efforts. And it would be difficult even to kind of list all of the different combinations and different partnerships that could come from advocacy efforts. Generally, once you start to talk to others and once you start to connect and reach out to learn from other people's experiences, things kind of just start to flow a little bit. But your goal in partnerships is that you want to be able to connect with other people. You want to find people who have been through similar experiences to you or to your loved one, again, so that you can see what's already been done, what worked for them, where did they find success. You want to really start to establish a network of supports. And that's going to be important not only throughout the process, but also when we get to the self-care phase, because we want to make sure that there are people in our lives who are concerned about our well-being as we take on what can sometimes be a very challenging thing in advocating. You could also build those supports if you consider taking part in a more formal support group. And depending on the topic, there are lots of support groups these days too that allow virtual participation. So you don't necessarily have to go in person. Perhaps you have mobility challenges, or perhaps you have a hectic schedule that doesn't allow. But a lot of those support groups that do allow virtual options are certainly a great benefit for some people. You don't want to be closed off to building partnerships with the experts either. Talk to your treatment providers. You want to be able to get their perspective on things. And a lot of times, treatment providers can be some of our own best advocates. If we think about certain programs, such as there are prescription assistance programs for individuals who have financial needs, and who may not be able to afford what are sometimes very, very expensive medications. Physicians usually are aware of those, and they oftentimes will suggest that this is a route someone would be able to take, and then they would assist by completing forms and advocating, for their patients to be able to have access to the lower cost prescriptions. So those partnerships with the experts, also you can utilize those partnerships to increase knowledge. Again, they have access to so much information that could be valuable. So becoming comfortable talking with your treatment providers could certainly be a key partnership to establish. While establishing partnerships too, it's going to be really important to remain open to new ideas and varying perspectives. And we're going to touch on that a little bit further when we get to the communication piece. But it's difficult when we only have our own perspective and only have one view on a situation to know all the other variables that might exist. So talking to other people and really hearing what they have to say, and it might change your perspective every now and then, but it's important at least to know kind of what's already happened, what else other individuals are facing. And you want to make sure to develop a list of important contacts as well in forming the partnerships. If you talk to someone or you're at a resource fair, for example, go ahead and grab their phone number, or ask if that's something that they'd be comfortable with, is exchanging phone numbers. A lot of times at different conventions, trainings, resource fairs, etc., there are often vendors there that give out business cards. That would be a great way to develop a list of contacts as well. In support groups, certainly could ask if other members are comfortable sharing their contact information, and keep the contact information for any provider that you've worked with who you've really felt would be a good partner in advocacy efforts as well. Next slide, please. In talking about communication, I'd like to take a moment to credit the following information to Dr. Karen Rigamati, who is a member of the board of directors for the Coordinating Center. Dr. Rigamati is a professional coach and facilitator, as well as a parent advocate. Much of what we're going to cover within this slide references Dr. Rigamati's work, Your Compass to Compassion, and six steps to achieving positive change. So we want to thank her for giving us permission to be able to share some of this information today. So when we're talking about communication, before we touch on her 6 notes about it, I want to just kind of put out there that everybody does have their own communication style. So we're going to talk through, kind of these 6 more universal notes about communication, but how you actually implement certainly could be dependent on your communication style. For example, some people are very comfortable with just going ahead and approaching a situation without a whole lot of preparation. They do really well with kind of that off the cuff conversation and communication and talking about things. Other people need to have everything written out to feel comfortable with presenting it to someone. And either way is a good way to communicate. you just want to be aware of what your best communication style is. If you know that you tend to feel a bit nervous going into a doctor's office, that might be an example of a time where it's okay to write out notes on a paper. We just went through the resource guide that had, the kind of planning steps to go to a doctor's appointment. It's totally fine to take notes and to bring a paper in and to be able to reference kind of what you want to make sure that you communicate. If you know that you are just fine with having that conversation and all you need is a reminder to make sure that you bring it up before you actually leave the doctor's office, you could set a timer on your phone or an alert on your phone. All different ways to communicate. Some people need to practice before they communicate. You could do that role playing with somebody who, you're comfortable with, whether they are in your house, whether it is a friend, whether it is a case manager. If you just want to kind of get that practice, if you're not comfortable practicing with someone else, you could certainly record yourself if you have the ability to do that on a phone, and play it back a little bit. Anything that's going to make you feel a little bit more prepared and a little bit more comfortable to actually voice, what you'd like to get out. And some people need to read directly from a script. Some people can practice and just take notes. So again, there are just a myriad of ways that individuals, communicate with one another. And there's no right style or wrong style when it comes to communicating. The important part is simply that you want to communicate it. You want your voice to be heard, in whatever format that might be. Okay, so we're going to talk a bit about these 6 steps. And the first is that you want to clearly state your needs. Know your objectives. Be sure to hear what others need if you're advocating for someone else. The communication is not going to be effective if it gets too watered down and too far removed from what your intent is. So you really want to practice kind of the clear needs and clearly stating your needs, and use simplified, direct language. Remaining open to other perspectives. This is really important as well, and we touched on this earlier. The active communication phase should really be free of judgment and emotion. You want to remain flexible, keep an open mind to what other people have to say. It could really introduce, some different ideas to you, and it could certainly cause your opinion to shift a little bit or your perspective to shift. And that's okay if that's the case. That takes us to our third note of be willing to switch your way. We want to remain not only open to other perspectives, but also open to the idea that additional information might actually cause us to change our minds about something. We don't have to remain so staunch in our views that, we can't have other people's perspectives come in and kind of, lead to a shifting of what we believe. You want to remain present, really be willing to hear what the other party has to say again. The next note would be seeking alignment, if not agreement. So it doesn't have to be that in communicating your needs, preferences, and wants that you pull someone else completely over to your side. They don't have to, end up aligning exactly with what you say. It's okay if they are open to hearing your thoughts and your feedback on something. And if they support you, moving forward and continued advocacy efforts, they don't have to necessarily agree 100%. You can kind of work almost in tandem, as two groups or two individuals kind of moving towards the same ultimate goal. Sometimes just the processes are different. Sometimes the processes are similar, but the end goal can be the same. Not sure if anyone has heard the phrase of practice yes and this can be really meaningful. When communicating with other people, again, remember we were always wanting to consider other perspectives, consider what other individuals, are thinking, feeling, what they're bringing to the table. We don't ever want to devalue what someone is saying when they're sharing their thoughts and views on something. So just as you want to communicate your needs to someone else and your wants to someone else and your preferences, the person you're communicating with likely wants to be heard just as much. You really want to validate what someone is saying. If they share a thought with you, your response could be yes, and then insert whatever you're going to add to the conversation. But by saying yes, you're acknowledging that you hear what they've shared and you're validating what they've shared as well. And then you're also able to kind of input your own contribution then at that point. So the yes and is a good thing to practice. Someone once told me that using the word but negates everything that was said before it. So I remember after hearing that, I tried to move more towards yes and. And what I mean by the but negating everything before it is, I hear what you're saying, but well, did you hear everything I was saying? If there's immediately something that we're going to say in contrast to that. So yes, and is a great way to start communication. Okay, and finally, we want to make sure that we are doing what we can right now. There are going to be setbacks along the way in advocating for yourself. There are setbacks along the way at all levels of advocacy. Doesn't mean that a difference not being made. It means that sometimes we are more limited in what we can do. Sometimes our outcomes are not quite going to be what we expect or what we hope for, but that's okay. We might not be able to move mountains, but we can certainly build a small bridge or take a small step here and there. So you really want to focus on what you can in the moment, given the situation, circumstances. One more note on communication before we move to the next slide would be the importance of modeling positive communication skills for other individuals, especially if you're someone who is advocating on behalf of someone else. For individuals, including children who are not advocating for themselves at this time, but maybe who want to and really have that desire to, modeling those communication skills for them is really key. Allow other people to observe you engaging in that open dialogue with providers. Allow other people to hear you utilize that yes and approach. It's really important, especially that we try to give everyone a voice to the extent possible. So we really, really want to promote that through modeling and teaching the skills necessary to get there. Okay, next slide, please. Okay, so our fifth step today in our self-advocacy process is perhaps one of the most important steps, and that is self-care. We hear the term self-care and things like finding a work-life balance, making sure that we are taking just as good a care of ourselves as we are of others often these days. But it's especially important in advocacy. Like we just talked about, there are those setbacks. There can be times of disappointment. It can be extremely stressful for some people to, kind of engage in that self-advocacy. So making sure that on the other side of it, you are well and taking good care of your own needs is going to be very important. Equally important for individuals who are advocating for themselves as it is for individuals who are advocating for someone else. So just a few notes on this. Definitely maintain realistic goals. If you shoot for the moon, although it's great to have high expectations, we also want to be realistic about what actually can be accomplished in a given time. It might not be that individual advocacy efforts are going to lead to introduction of a bill and it being passed all within a 3-month time frame, for example. Things take a little bit longer than that. Baby steps are still big steps when it comes to advocacy. You want to remember that it is absolutely fine to ask for a break or help, and you should ask for a break or help. If you're the individual advocating for themselves, then asking for a break might look like asking a loved one if they can step in and give you a hand with really trying to get your concerns and your needs and your wants communicated to someone else. If you're the person who is advocating for someone else, asking someone else for help might look more like asking another individual who is close to both you and the person you're advocating for, if they can step in and offer some assistance at some times. It's okay to take a break, absolutely. You need to maintain regular space in your life that's free from advocacy also. There are times when causes might become completely consuming, and that becomes just the primary focus of all that you're doing. Without that space to kind of step away from the advocacy, you really risk that burnout factor that comes into play sometimes. It's okay to establish limits with other people. You might find that you advocate for yourself or for someone else to such a degree that you become also known in the community that you're in as being a great point of contact for others to reach out to. So you go from being the person who is looking to establish a support network to the person who is a sought after support for other individuals. And at that point, you might need to say, I can really only talk about all of this during the day. When it gets to be the evening, I need to be able to spend time to myself, or I need to be able to spend that time with my family. And I just need to put a limit on it. Maybe you can't take calls all hours of the day about this. Maybe it's something that you look into doing on the weekend. Everybody has kind of their own limits and their own level of comfortability with how much advocacy can kind of be a part of their lives. So establishing limits with other people and kind of compartmentalizing that part of your life is absolutely okay. You want to communicate with other people about any struggles that you're experiencing. And, sometimes the best kind of sounding board is someone who's been through something similar to you as well. They might have shared their struggles. They might really be able to give you tips on how to come out on the other side, and how to kind of make sure that you are well and feeling healthy and well in the process. And possibly also consider introducing mindfulness activities to your daily routine. Um, I say this often when I do a mindfulness activity, that if you had asked me years ago if this was something that I would find relaxing, engaging in something that was mindful, focused on mindfulness, I would say, I'm not sure. I'm just always so busy. I don't even know if I have the time to be able to stop and kind of take part in that. And that was right up until I did a quick little relaxation technique with a group that I was teaching on progressive muscle relaxation. And the reason I introduced that was because the group of folks had been through an awful, awful lot. So their stressors were very high. And to even be able to talk about the information that I was presenting, or have anyone be able to focus on it, it felt like we needed to have kind of a shift, kind of get people outside of that moment that they were in, that oftentimes involved a lot of trauma. So we did a progressive muscle relaxation walkthrough, and I walked through and talked through probably about a 10 or 15 minute progressive muscle relaxation exercise. And for those of you who aren't familiar with it, progressive muscle relaxation essentially involves tensing and then relaxing all of the muscle groups in your body. And the ones that I do usually start with your head and go all the way down to your toes. And the idea is that by tensing and holding each of those groups for a minute and then kind of visualizing that release of the tension, it really puts you in a different space. So when I read through a script for this group of people, I found myself doing it too. And I was really amazed at kind of the relaxation that I felt afterwards. It really allowed you to just kind of tense and then set everything free. So I became much more open to the mindfulness exercises after that. And we practice those within our teams here at the coordinating center as well. There are all different ways that you can do this. You can do, of course, as I said, the progressive muscle relaxation. There's guided imagery, there's deep breathing, there are very brief exercises, and there are longer exercises. For those of you with internet access, there are a limitless number of scripts and links that you can use, and be able to access some of those things. And oftentimes it's as simple as if you have internet access, a Google search, and type in guided imagery or mindfulness activities even, and there'll just be a host of things that come up. You can click on them, give them a listen, and see if any of those seem to work for you. But self-care, again, is just a huge, huge part of advocacy, because we really need to make sure that we are keeping ourselves fresh, not burned out, and just in a good space to be able to dive into what can sometimes be some pretty difficult work. Okay, next slide, please. So we're going to take a moment just to kind of round up those 5 steps in self-advocacy. Again, we want to remember to educate. That's probably the first step, is when you recognize that there's something that you want to advocate for yourself about. You want to learn as much as you possibly can about that. And again, our ways to kind of gather that information would be internet searches, other individuals, the local public library, information that your care manager, that your treatment providers can provide to you. Don't ever hesitate to ask if someone has additional literature on something. I always appreciate it when someone says, I have access to this, whatever the wealth of knowledge might be, and I'd be glad to share it with you. More information is always better than less. Then we want to make sure that we're organized and that we have some sort of organizational system in place that can house all of the information that we might need in order to kind of continue with our advocacy efforts. So if you are finding yourself in need of a tool to organize, like your medical records, for example, follow the link on putting together a medical binder. It's really simple steps. Again, it doesn't involve anything fancy. And to collect your documents, you can use anything that you have around the house even. There's the other link that we have on accessing that toolkit, and it has all different scripts and all different kind of note-taking options that you can use to be able to gather your thoughts before an appointment or before a type of communication you might have to have. You know, take it with you to your appointment, use it to maintain records afterwards. And it's just a really, really great wealth of resources out there related to organization. You want to make sure that you're connecting with other individuals, whether they are folks who have been through something similar to you, support groups in the area. And if you need any assistance with finding groups like that, we're going to include a few links as well that, again, we'll send out after today's presentation. But establishing those partnerships and getting that support network in place is going to be key. You want to make sure that you are communicating your needs in an effective way. So when you advocate for yourself, follow some of the things that we talked about as far as making sure that you're stating everything clearly, that you're hearing what other people are saying too. You just want to make sure that you're taking those steps so that your communications is as effective as possible. And finally, that roundup and potentially the most important piece is making sure that you're taking good care of yourself. Asking for help, taking a break when you need, finding some non-advocacy related relaxation, spaces for yourself outside of the realm of advocacy efforts, just to make sure that you are healthy and well. Okay, next slide, please. Okay, these are just a few of the many, many, many resources that exist. And Heidi is going to show us, let's see. So we have, just hold on this slide for 1 minute, please. So under the organizational side, we've got another QR code for how to build a medical binder, which is a great resource, and it kind of walks you through step by step. And then we've got the link for taking charge of my healthcare toolkit. And there's another advocacy tool template there for, I believe it's from the Share for Rare website as well. Then on the informative side, these are just a couple of examples of websites where you can find additional information, not only on advocacy efforts, but on local support groups, other resources that you can access, and things like that. Heidi, if you don't mind sharing the QR code for the education advocacy resources, we'll just give everybody a quick glimpse of the wealth of information that can come up just in doing a quick Google search even. So if we are talking about looking for resources within the educational system, the Maryland Government Department of Disabilities has an entire section on education advocacy resources. And it's as simple as, once you go to this link, you can click through the various different options, and you can see that there's a host of information here. Even just on this particular website, one of the other resources you'll get is for Parents Place of Maryland, as well as the Maryland Disability Law Center and the Maryland Coalition of Families. You don't necessarily have to find the exact resource that you're looking for and their phone number. If you contact one of these places or an organization that helps others by offering advocacy resources, they're going to be able to point you in the right direction. And I think that that's key. Is it's okay to ask as many questions, explain your situation in as many different ways as you can, so that you can hopefully get to the answers that you would like to have and that you need. Okay, next slide, please. Thank you, Heidi, for sharing that. Okay, we're going to end, or we're going to almost end. I'll go over one more slide after this, but we are going to just run through a quote from the great Maya Angelou, who is an American poet, activist, and author. And she said, "I learned a long time ago, the wisest thing I can do is be on my own side, be an advocate for myself and others like me," which is just so true. And I think kind of summarizes what we've talked about today. It's so important to be able to find your voice or your means of communicating what your needs, wants, and preferences are. Again, services are person-centered. All services are person-centered, and they should really focus on you, and they should focus on what you need to get, and the services that you need to get. So with that, next slide, please. I want to remind everyone before we close for any questions that may have come up that our upcoming webinar in our community enrichment series is going to be presented by Alyssa Stoffel and Cheryl Nickel, and it is Transitioning Youth, What to Know as You Grow. It's designed to guide families and caregivers of children living with disabilities or complex medical needs through the journey of transitioning youth. It offers that introduction of the importance of the transitioning youth process, advocacy programs, and important milestones. And for those of you who aren't familiar with the term transitioning age youth, it is the area between adolescence and adulthood, and historically was at times an underserved population with needs that are just so significant and specific. So it's wonderful that there are so many resources nowadays for transitioning age youth. So we're looking forward to that. You can register online or you can scan the QR code. Okay, and I saw that Renee's comment in a chat to me was that we didn't have any questions at this time. Just double check that that is still the case. Okay.